Domestic violence related deaths are on the rise in Ohio over the past year. That's according to a report released this week by the Ohio Domestic Violence Network, which shows a 35% jump in the total of fatalities compared to the year before. The numbers reverse what had been 2 years of a decline, and some experts are blaming the shutdowns and isolation that came from the coronavirus pandemic. Joining us to go over what we're seeing here locally is the Director of Training with the Ohio Domestic Violence Network, Alicia Williamson. Thank you so much for joining us.
Good morning, Lindsay. Thank you for inviting me today.
Absolutely. This is such an important topic. We can't stress that enough around here, and something that you and I have talked about a few times over the years in my meetings with you. Now, we talked with you early on in the pandemic, though, when the shutdowns and the restrictions started. Would you say that these shutdowns had a direct negative impact on those that are forced to stay in violent home situations? Maybe this contributed to the rise in deaths?
That's such an important question, Lindsay. History has shown that domestic violence tends to increase in the aftermath of disaster. The pandemic, which led to stay-at-home orders and deep economic distress, likely is contributing to more violence. As you stated, Ohio Domestic Violence Network, every year we release a fatality report, and the report that was just released this past Tuesday counted 109 fatalities from July 1st of last year to June 30th. And that's about 35% higher than the total reported last year. But during the first few months of the pandemic, domestic violence fatalities were 14% higher than during the same period in 2019. And in the Mahoning Valley, there were 5 fatalities.
Okay, so we're definitely linking it to those first few months especially. When you break down, what you're seeing in our area and whether there's a part of the valley seeing more domestic violence incidents than another, have you been able to kind of break that down, where you're seeing an increase in calls or people seeking services?
We are still figuring out the long-term effects of the pandemic on survivors and their children. We know survivors may be less inclined to seek help, but they must take their children to a crowded shelter. We know that in some parts of the state and even the country, law enforcement and domestic violence providers are reporting increases in domestic violence and the severity of that violence.
Now, does your report break down counties or local areas? Do you know where the deaths took place? Any in our area that we can report?
Yeah, so there were 5 fatalities. There were 2 in Trumbull and 3 in Mahoning County.
It's just so devastating to hear. Talk a little bit about the outreach that you have here in the region in Mahoning and Trumbull counties, Columbiana counties, that you know of, and what you're hearing on the ground. What are the things that they need? What are the things that they are seeing? Because when we had the onset of the heroin epidemic and the opioid epidemic, we were seeing an influx of people in need and coming in with young children even then.
Right now, the need is definitely funding. Unfortunately, our domestic violence shelters here in the Mahoning Valley received catastrophic cuts to their VOCA grants just 2 weeks ago. These cuts were between 33 to 41%, and programs will not be able to provide that same level of service provision, which directly impacts the safety, security, and well-being of independence of survivors and their children. The loss of staffing and services may leave survivors questioning if they would be better off staying with the abuser or returning to an abusive environment.
And it's not a good time with the economic situation and the ripple effect. It couldn't come at a worse time for places that need this kind of money. So it's almost like just a circle of, just terrible trends. So what would you suggest someone do? If they're in a tough situation, who do they reach out to, and can they feel safe right now?
Yes, we have, our shelters are still open. They are still providing services to victims and survivors. They can call their crisis line if they're trying to get help. Most times that they can go actually on the internet to be able to see if there is a web-based chat where, because it may not be always safe for someone to actually call. I'm urging for family and friends to reach out to those loved ones who they may not have heard from in a while. Being able to stay connected and giving them the support that they need is going to be crucial in this time.
And real quick, where can people donate, or the community? How can they help? How can they reach out and, maybe be a part of the solution?
We need the community now more than ever. We are making a plea to all of our community partners, foundations, and private funders to support their local programs, advocate for them, and contact legislators to garner support for these critical services.
Yeah, I definitely feel for the families, the women with kids that are making tough choices right now. It's so hard, but you are there for them. So we wanted to make sure they
Yes,
knew
we
where
are.
those resources were. Thank you so much for joining us this weekend.
Thank you.